The pancreas is a large, flat gland located at the abdomen, behind the stomach, and close to the duodenum. What is pancreatitis? Pancreatitis is the inflammation and autodigestion of the pancreas, in which pancreatic enzymes destroy the tissues of the pancreas itself. The inflammation is usually caused by two factors, which are gallstones and excessive alcohol intake.
So the gallstone is because if the stone passes out into the structure that we call as the common bile duct, where the pancreatic duct also originates, and that can block the pancreatic duct and cause an inflammation. Well, alcohol is causes acute pancreatitis because chronic. It's not just one binge of alcohol intake. It's the chronic intake of alcohol would produce obstruction or blockage of the pancreatic duct, and that causes the pancreatitis.
There are two types of pancreatitis: acute and chronic.
Now, acute pancreatitis is divided into three types according to its severity. It can be mild, moderate, or severe. And we have different tests to be able to determine whether the patient is in such state. Now, the most serious of all definitely is severe pancreatitis, and the patient can die within 24 hours after the attack of acute pancreatitis.
What are the signs and symptoms of pancreatitis?
Well, the most prominent symptom that the patient would feel is epigastric pain, which is very severe. When we say severe, the patient would usually wrench in pain, put their hands on the abdomen, and would bend over because of the severity of the pain. And it is accompanied by cold clammy sweats and nausea and vomiting. In some patients, wherein it is usually secondary to a stone, a gallstone, the eyes of your patient can become yellow, or what we call in medical terms as jaundice.
How is pancreatitis treated?
Well, acute pancreatitis is should be treated initially with recognition of the disease, and as well as early what we call as intravenous transfusion. So for as long as you improve the microcirculation early in the stage of the disease, then the prognosis and recovery from the acute illness is very important. Now, so depending on the severity, usually it's the severe pancreatitis that we have to put in the uh, intensive care unit, because we have to monitor the blood gas of the patient. We have to check also the chest x-ray if there is a complication in the lungs. Then we have to monitor the vital signs of the patient, the blood pressure, the urinary output, and we'll have to do it because the prognosis will all depend on how the patient improves within 24 to 48 hours.